Make sure patient's feet are on the floor and back is supported. Make sure the cuff size fits the patient properly. It should be tight and snug, not loose or not too tight. Once you've found the proper cuff size, you want to wrap the cuff firmly around the upper arm at heart level. Align the cuff with the brachial artery. Most of them say it on there. And make sure the cuff is tight. With the stethoscope, you want to make sure that the earpieces are facing away from you. You want to make sure the stethoscope is on. You can tap it and you'll hear it make sure it's on. If the stethoscope is not already on, you can turn it to make sure it's on. Once you hear the tapping in your ears, you're ready to go. Place the stethoscope chest piece below the antecubical space over the brachial artery. Also, make sure the patient's arm is dead weight. It makes it easier if you place the patient's arm on your shoulder. Next, make sure the lever on the back is pushed up and inflate the cuff to about 200 millimeters of mercury. You want to slowly release the pressure at about 2 to 5 millimeters of mercury per second. The very first sound you hear will be the systolic blood pressure, which is also known as phase 1. You'll continue to hear sounds that will fade out slowly, and the very last sound you hear is considered your diastolic blood pressure, which is also known as phase 5. With these two numbers, you'll have your total blood pressure. With your two numbers recorded, the last step is just to remove the cuff and explain to your patient what you've heard.